today we're going to be asking Dr. Christine Bowen, how do I know if I have autoimmunity?
That is a great question. So typically it takes people quite a while to get their formal diagnosis with autoimmune disease. And I know from being in a lot of Facebook groups and communities that there's a high level of frustration with trying to figure out whether or not you have autoimmune conditions or whether it might be something else. So it's important to try to get to the root of it. And so typically something that will give you the suspicion that you have autoimmunity going on or autoimmune disease is symptoms. And so you may have symptoms of joint pain, you may have symptoms of digestive distress, things like diarrhea or abdominal pain, maybe even blood in your stool. That definitely is something that is not normal, and you should speak to your doctor about that right away. So maybe you've had these symptoms. I know for me, my hair fell out previous to getting my diagnosis of Hashimoto's. My weight was fluctuating, my energy was fluctuating. So for M had psoriasis or has psoriasis. And so in the beginning, it was like, what kind of skin inflammation is this? Is it an allergy? Is it an irritation? Is it eczema? Is it, what is it? And so you may have some of these symptoms that are pointing towards autoimmunity. And so the symptoms normally raise your level of suspicion that you might be dealing with autoimmune disease, but then it doesn't really answer the question about whether or not you truly have autoimmune disease happening. So there are definitely some things that you can do to pursue answers. And so oftentimes you'll have, in addition to the symptoms, you also have a gut feeling. So whether it's actually the physical gut feeling, your gut doesn't feel well, that definitely can be a sign that you have autoimmune disease. But it also can be a feeling like, okay, I'm looking around and I'm seeing, I have a few family members with autoimmune disease. It presents a little bit like this. And so it can be a combination of like your intuition as well as some of your life observations that are leading you to have a higher suspicion of the fact that you're dealing with autoimmune disease. But then really the answers come when you start getting testing. And so if people come to me and they have all of these symptoms and they have the suspicion and they have the gut feeling and they have some family history, then we're normally diving straight into really deep testing to get to answers. And so some of the testing, for example, is an ANA, which is an anti-nuclear antibody test. And so this can test for about 10 or 11 different types of autoimmune disease just in one test. There might be things like inflammatory markers. So whether these are inflammatory markers in your blood, like one of them is called SED rate or ESR or erythrocyte sedimentation rate. This is a big name for just telling us a little bit more about how our red blood cells are sticking together. And this is a measure of inflammation in our system. There's another marker that's called high sensitivity C-reactive protein, or even just the regular C-reactive protein. These are inflammatory markers that we can look at in the blood. So something like testing for an ANA or an ESR, high sensitivity C-reactive protein. If it's joint pain that you have, maybe you want to test for rheumatoid factor to see if it looks likely that you have rheumatoid arthritis. If you have spinal inflammation that has not been diagnosed yet, then maybe you need some x-rays. Maybe you also want to have Ankylosing spondylitis ruled out. That's through a test called HLA-B27. So there are all of these different tests, but once you tell your provider about the symptoms that you're experiencing, then they should be taking quick action to do some of these tests. And if they aren't ordering these tests, and sometimes we take our health and healing into our own hands, and we can order these tests for ourselves from third-party companies that sell lab testing direct to consumers. So if your providers are not ordering these tests for you, maybe you need to go out and pursue how to order them for yourself to be able to get these answers. So if it's things like lupus that we suspect, then we might be checking for kidney health with urine tests or blood tests, so there are just so many tests that you can do to really help to get answers. Hashimoto's thyroiditis, you test for thyroid antibodies. And so one of these is called thyroid peroxidase antibody, and the other one is called thyroglobulin antibody. Without those antibodies, you won't know whether or not you have Hashimoto's. And so those are just simple blood tests. So a lot of it is simple blood tests. So you take this information, so symptoms, gut feeling, intuition, test results, and then oftentimes we'll go for a confirmatory appointment to try to get that final definitive diagnosis that you do have autoimmune disease. And so then you might end up seeing somebody like a rheumatologist or a gastroenterologist or a dermatologist to be able to get this final diagnosis. And normally they can say, in most cases, they can say beyond a shadow of a doubt, you definitely have this condition at that point. And so that's important because then when we know what our diagnosis is, then we can craft the right healing plan for those conditions. So sometimes your specialist might be a functional medicine doctor or a naturopathic doctor, but getting those answers, getting those tests will at least take you out of that space of wondering and feeling frustrated. Sometimes there's relief in finding our diagnosis, even if we hope that we don't have autoimmune disease. There still can be relief in finding our diagnosis because then we at least have a starting point. And then we at least have a frame of reference for understanding what's going on. And was that like your experience in getting a diagnosis? Can you tell me a little bit about getting your diagnosis?
Yeah, I think that was similar. There was definitely the looking at other family members who had psoriasis as a like, I don't want to have that, but I think I might. Reading up on my symptoms, what do they point to, and then having testing to get some clarity. And I just want to let folks know that we will put the tests that Christine mentioned in the comments of this video so that you can have more information, especially if you were like, oh, I think maybe I have lupus. So you're like, what was that test? We'll put it there so that you have that resource going forward to talk to your practitioners.
Absolutely.
So much.
Yeah, absolutely. So we will make sure that we're sharing more information about testing as we go forward. But we just wanted you to have this little bit of a, nutshell look at like trying to figure out whether or not you have autoimmunity and some of the steps that may need to be taken to do so. So thank you and have a great day.
Please subscribe to our channel and hit the notification bell to be notified when we post new content.
Make sure to follow us on Facebook and other social media.